Away from that, in Kenya, the AIDS epidemic once tore through families, strained institutions and ignited desperate searches for a cure. Now, among those who stepped forward with claims of having discovered a cure was the late scientist and researcher Professor Arthur Obel. In the mid-90s, he made headlines with Pearl, Omega and Cameron treatments he marketed as protease inhibitors and potential cures for HIV and AIDS. Though it's controversial, his work sparked national debate and drew global attention. Now, NTV Science and Health reporter Helen Aura takes us through Professor Obel's legacy.
Professor Arthur Obel, who will be remembered by many for his efforts in the fight against HIV and AIDS in the mid-1990s. Born in Kenya in 1945, he pursued medicine and furthered his education abroad, where he obtained advanced degrees in pharmacology and medicine. Obel rose to prominence in the late 1980s and 1990s at the height of the HIV and AIDS crisis. While millions in Africa were affected and antiretroviral therapy was still inaccessible to many, Obel announced that he had discovered groundbreaking treatments. Cameron, an AIDS drug derived from low dose of interferon, it was promoted as capable of boosting immunity and even reversing symptoms. Pearl Omega, marketed in the mid-1990s as a protease inhibitor and potential HIV cure. Patients were reportedly charged large sums of money and many testified to improved health. For both drugs, he faced challenges as international regulators questioned the efficacy of the drugs as well as scientific validation to prove that the drug was indeed working. The Pharmacy and Poisons Board of Kenya challenged the safety and approval of his drugs. The Kenya AIDS Society sued him in 1998 for fraud, claiming his drugs had not been scientifically proven. Obel also took a blow from international media, calling out his labeled Pearl Omega a hoax cure. Despite criticism, Obel remained defiant, insisting his discoveries were genuine. His family says the renowned researcher died at a Nairobi hospital after battling a terminal illness. Helen Aura, NTV.